Meeting to order. Can I get a motion to approve the previous meeting minutes? Motion by Gary. Second by Joanne. All in favor? Opposed? Local law number 1, 2016. A local law of the County of Albany, New York, prohibiting the sale of cigarettes, tobacco products, liquid nicotine, or electronic cigarettes to minors and young adults. As we know, there was a public hearing on that last night. Paul's here if anybody else has any further questions. Does anybody have any questions for Paul?
Yeah, I have a question. I went to the public hearing. Where is it?
Is it back behind you?
Oh, okay. A lot of them talked about how cancer is bad, and there's no doubt about it. That's a clear conclusion. The real central issue that I find is this idea: can we compel an 18-year-old adult to act not to act in a way that's contrary to their own interests, which is of course what smoking is. How would you speak to that?
Well, I think it's not, first of all, the law is not going to stop them from smoking necessarily. It restricts the sales of cigarettes. So somebody wants to get out there now, and they raised that issue last night. They'll want some other county until it comes to a point where it becomes statewide law, and then it won't be eligible anymore. But you can't. But it's no different than when they raised the age of drinking to 21. That was 18, and went up to 21, and you're compelling them to do something. The age 18 is not an arbitrary age. If you think about it, voting age was 21, and you just set down to 18, and it's a decision, and it's basically the fact that nicotine is so addicting to people, and it causes problems with young brains when they're still in development stage. It gets them. It's more addictive to people that are less than 25 years old because their brains haven't fully matured. So that's really what we're looking to do, is to try and reduce the amount of smoking. We're not going to stop it. I mean, I'm not going to tell you we're going to stop all smoking under 21 or even under 18 for that matter. I mean, there's still going to be people who are going to smoke under 18. All we're trying to do is discourage it by moving up. The first thing that we're trying to do is move it out of the high school, because you've got 18-year-old seniors in high school right now. They can go out and purchase cigarettes and they can supply it to any of their friends who are in high school. And I'm sure that happens a lot. I'm sure there's also people that get it from other adults, but I think it's probably pretty common in high school when you get a classmate that can go out and buy cigarettes at the local store, that they go out and buy them for you.
Thank you.
Okay, any other questions? Can I get a motion to move?
So moved.
Motion by Joanne, second by Sam. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Thank you. Number 2, encouraging Albany County employees to adopt a healthier lifestyle. Mike, I understand there's a department withdrawal on that?
That's correct.
Thank you. Under current business, number 3, authorizing an agreement with the New York State Health Department regarding the lead poisoning prevention program and amending the 2016 Health Department budget. Commissioner Rowland?
Good evening, everybody. This one is just a continuation of a grant that we have administered for a number of years. So it's just a new grant cycle. This is the lead. I think it's yours.
Sure, of course.
I made it with one and without the other. So this is the lead poisoning prevention program. So we're working with local pediatricians to identify children that have had high lead levels, and then we go into homes and do evaluations and remediations if necessary. So this is part of services that we provided for a long period of time. It's just a new grant cycle.
100% state, correct? Any questions for Commissioner Whalen?
Do we know how many children have elevated blood level? I mean, you have a way you just described, they're trying to find that out, but do we track how many kids had elevated blood levels, 3 years ago, 2 years ago, 1 year ago, that kind of thing?
We do track that, yes.
How are we doing?
We're doing better. Obviously the architecture in Albany is pretty old, so we know that houses that were built prior to the 70s have a higher risk for lead, and as these houses become painted, the risk of exposure to lead is less than it has been in the past. We are very proactive about going out and doing a primary prevention, which is a different grant that looks at homes and looks at home risks. So we have a couple of different grants that address that before the child gets an elevated lead level, so I think that that's definitely working to improve the problem, and we do track that.
So, in other words, we know who has lead, but we aren't sure of the ones that may have elevated lead, but we haven't detected yet?
Well,
We have
lead,
some sense of what that might be?
so lead levels are supposed to be monitored in children when they are seen at their pediatric visits before the age of 2. At least they should have 2 lead levels. So that is something that, most children that are followed by pediatricians, they should have done. So those levels, if they're elevated, the pediatricians do get back to us, and then we circle back with the families and do education and provide necessary referrals, and then go back and look at the home and see what the risks are there.
Do we have fewer kids with high lead levels now than we did 3 years ago, for example?
3 years ago, I'd have to look at the data. I know as to over time, it has gone down, but I can't comment specifically on 3 years ago versus now. I'd have to look at the data.
Send that?
Sure,
Thanks.
yep.
Thanks. Any other questions for Commissioner Whalen?
Can I ask a related question? You have a related question? No, go ahead.
No, I'm going to move it.
Oh, now, I just want to ask the Commissioner, can we get statistics on the impact of secondhand smoke in Albany County, and also the cost of treating smoke-related illnesses? Do we have
Well,
that data?
The impact of secondhand smoke is difficult because we don't have county-specific metrics to look at that. I can certainly give you a lot of data on national data on impacts of secondhand smoke, and we know that impact can be serious for across the age spectrum, particularly in young children that are developing, children that have asthma or allergies. We know it exacerbates this. We know that there are causes of cancer that result from secondhand smoke. So the data very strongly supports at a national level that there are significant dangers posed by secondhand smoke. And we worked with the Albany Housing Authority to help implement a smoke-free policy, because we know that it's not just, if you're living in a larger units where, as opposed to a single freestanding home, there can be a significant amount of air that's shared between units and apartments.
Thank you. Is there?
Cancer Society, we get that from there, or the Lung Association. They get it by county.
Okay, is there any questions specific to the lead poisoning prevention program for Sam?
Yes, due to what happened in Flint, Michigan with the lead in the water, are we doing anything to monitor lead in pipes? Because I know Albany's an old city, there's a lot of pipes that probably have lead in them.
Right, it is an old city, and we do monitor the lead in the water on a regular level. Certainly, and that's something that we continue to do and work very closely with our water authorities. Our department does do a lot of that testing and liaises with the various municipalities and cities on the water supplies that they have to do that kind of testing. If there were a situation like that, we would expect to also to see a spike in lead levels in children. But again, the situation in Flint was very different from what could hopefully never could occur anywhere else. I think that there were so many layers there that were failed that the engineer that is in our department said to me, if that happened in Albany, not only would I expect to be out of a job, I'd expect to be in jail. So I think that we have a level of assurance with the testing that we're doing, that we are looking very carefully, and we certainly do realize the infrastructure issues with Albany. It's a very old city.
Thank you. Joanne?
Yeah, just a question on once there's an identification made about a child living in a situation, a housing situation where there's lead paint. So what happens next? Is there a requirement that the landlord do anything? Is there a requirement if they're receiving some kind of public subsidized housing that the landlord do something? It just seems like over time, this issue would just kind of naturally go away as buildings are upgraded and so forth.
Well, buildings can be upgraded, but a lot of times, I live in a 110-year-old house, and the window sashes are the same as they were, even though all the windows have been upgraded. So the lead paint is still there, but it's just deep, and it's really when you get into a situation of people that aren't keeping up the maintenance of their house, where these layers of paint can become exposed. external paint isn't as risky for children as internal paint,
Right.
so we definitely want to focus on that, and particularly younger children, because we know the neurodevelopmental problems occur usually at the younger age of the spectrum than older age, and at that age, kids are more likely to grab and mouth things, so the contamination is more likely to occur. So we usually go into the homes and we work, if it's a rented property or if there's a landlord, we do work with the landlord and follow through to see if that, how we can remediate that. There are certain programs that if there is financial hardships, we work with people to try to provide that service, and there are different areas of outreach that we can do that. And, if we know that they're not compliant, they do get cited.
Okay, so if a landlord says, yeah, I know I have lead paint and I'm not really willing to do much about it, or I can't afford to do something about it.
Yep, they get cited and they get fined, yep.
Beyond that, there's also communication between the Department of Health, Department of Children and Families, and Department of DS and Department of Social Services. Social Services, if they're paying, whether it be a portion of somebody's rent, or even if they're paying utilities or just safety deposit, we have a referral system with the city code. It's really a city code responsibility, but if there's a child or an adult for that matter that is in danger for any type of hazard, lead, mold, activated asbestos, or just general dangerous living conditions, infestation and things of that nature, then there's an immediate, bed bugs is the new big one too. There's an immediate effort to relocate them, as well as a referral process to city codes to have the location checked out. Of course, that has a trickle-down effect on their ability to rent to anybody in general, as well as being fined if they don't remediate the problem and things of that nature. So there is a formalized system in that regard too.
Okay, thanks.
Thanks, Mike. Thanks, Joanne. Any further questions for Commissioner Whalen? Hearing none, can I get a motion to move? By Gary, second by Joanne. All in favor?
Aye.
Any opposed? Thank you. Number 4, amending the 2016 Health Department budget, Ebola, Zika preparedness and response planning. Commissioner Whalen?
Hi, okay, so this one is, we were given one-time funding through New York State Department of Health for Ebola, and it was around couple $100,000 that we weren't able to spend. It was for Ebola from the state and emerging infections. This was put into our fees for services line, and now we're just moving it into equipment. We are going to use this probably with the original intent of the money that we received in the first place, in line with planning for Zika virus and education. We plan on purchasing computer equipment, including whiteboards, et cetera, to be able to provide training and education, and also work toward development of plans related to Zika virus and other preparedness activities. So this is money that we already had, we're just moving from one line to another.
Does anybody have any questions for Dr. Whalen?
Doctor, so is this a shift, because Ebola has become less prominent, and Zika's become more prominent, and you're shifting money there where you really need it?
Correct.
Even though the online item hasn't really caught up with the quick change in time circumstances?
That's right.
Okay, any other questions? Motion moved by Gary, second by Joanne. All in favor? Any opposed?
I just want to let you know, I've got these booklets here. There are 2015 program and services reports that go through the programs that we have in the health department. I know there have been questions, and we were lucky to have some of the legislators come and visit us last month. Thank you very much for coming. This gives some, and it's 2015, so it gives current information along with some statistics. If anybody would find it useful, I'll leave this here.
Thank you, Commissioner.
Thank you.
Okay, Dr. Giordano. Number 5, amending the 2016 Mental Health and Children, Youth, and Families Departmental Budgets, New York State Office of Mental Health, and OASIS funding.
Good evening, Mr. Chairman. This is money that is coming to the Department of Mental Health from the state. It's to advance the transition to Medicaid managed care, which for the adult treatment system is happening this year. For the children's treatment system, it's happening the following year. This is a health information technology grant that's being given to our mental health program for children, which is run by DCYF, but the money comes to us. It's 100% pass-through funds from the state.
Does anyone have any questions for Dr. Giordano?
Do you want one?
Can I get a motion by Gary? Can I get a second? Second by Mert. All in favor? Any opposed? Thank you.
Thank you.
Number 6, amending resolution number 500 for 2015 regarding vocational services for the mentally ill and those with chemical dependencies and amending the 2016 mental health departmental budget.
Mr. Chairman, may I ask you to just clarify that for a moment? Is this for the Office of Persons with Developmental Disabilities?
Yeah, you have a copy of it there? It's number 6, regarding the vocational service, yes, yep.
Right. So this is an afterthought by the state. Last year I came before this body to request additional money for a cost of living increase to our mental health providers, our addiction providers. This is for one of the programs that is operated by the Office of Persons with Developmental Disabilities. This $13,297 is going to Northeast Career Planning for the workshop, and it's a cost of living increase for their staff. Again, it's 100% state funding passed through the county.
Just pass through money. Does anybody have any questions? Hearing none, can I get a motion to move?
So moved.
Motion by Joanne, second by Gary, all in favor?
Aye.
Any opposed? Thank you, Dr. Giordano.
Thank you very much.
Motion to adjourn? Gary?
What's next?
Personnel? No.
I got it written down upstairs. Drake, how are you, sir?
Personnel.